Hi, everybody. On the OutMarket.Pro podcast, I enjoy chatting with business owners and other professionals who are making a difference in their own communities. In today's podcast, I'm pleased to welcome Sherri Williams of Health Maintenance Advantage. Sherri has over 20 years of nursing experience and now uses her skills and passion to help patients navigate chronic health issues, improve their outcomes, and lower their healthcare costs. In this episode, she'll share more about her experiences with patient care, plus talk about how she and Health Maintenance Advantage help improve the quality of life for people with chronic conditions. Welcome, Sherri.
Thank you, Mark, for having me, and hello, everyone that is listening. So I am Sherri Williams. I have been a registered nurse since 1994. I have done many, many things in the field of nursing, and my last, I'm going to say, 15, 16 years has been in case management. I love what I do, and I have decided that not just the broad spectrum of case management, but disease management is more important than, well, I can't say more important than, but it is as important as case management as a whole. So anyway, disease management is the business, and we are supported by remote medical monitoring, which means, I'm going to give you an example. Disease management, we manage 4 diagnoses. Those are diabetes, cardiovascular disease, which includes hypertension, COPD, and hypertension, that includes hypertension. So those 4. Let's say that you have congestive heart failure, which falls under the cardiovascular disease. We would send you a scale because part of that, I would educate the patient as to why they have a scale, and a blood pressure cuff. So once you get those, you are on a program and you do your monitoring as we have decided when you need to do it, which is first thing in the morning to do your weight. That live data comes to us. There's things that we're looking for with the blood pressure as well as for the weight gain. And so with that live data, when it comes to us, then we are able to call you if we need to, develop a trending pattern for your physician to see, because although this disease management and remote medical monitoring is a registered nursing service, we are guided by the physician. So this is physician guided. We work with your physician, understand his plan of care, understand his challenges that he's having with adherence, compliance, medication regimens, all of that, to work with him to develop positive outcomes, because that's the whole goal, positive outcomes. So our clients are hospitals, hospitalists, medical groups, private practices, insurance companies or payer sources, and corporations, because corporations want to keep their employees healthy as well. Our goal is to decrease readmission rates and those high utilizations, to promote adherence to that plan of care that the doctor has, the prescription for treatment that the doctor has, and to lower the cost, because we believe that health is wealth, not only for the individual, but for the nation, right? So, and maintenance of that health is an integral part of the health wealth. And we believe by partnering with our services is an advantage not only to the patient or client or member that we're serving, but also to the providers and to the nation in general, because improving health literacy, if you understand why you're taking a medication, if you understand the physiology behind your heart, behind your lungs, behind your pancreas, then you're better able to manage your diagnosis because you understand it and you can correlate why this medication is important.
Wonderful. So you provide equipment. This is not just done on Zoom. You provide the video equipment for the patient and the monitoring equipment that they need for their particular diagnosis. Is that right?
Correct. Well, the video equipment is going to be either their phone, their cell phone, or their computer. That's how that we can communicate with them or see them. we can call them on their phone and not have video. You don't have to have video, because someone who weighs themselves at, if they get up at 6 o'clock in the morning, they're maybe not ready to be on video with their nurse, right? So we don't have to do video, but it's an option. And so the equipment doesn't have video capability to it. It's simply a scale. It's a blood pressure cuff. It's a glucometer, or it's a pulse
Okay.
oximeter. And that data comes to us, to our platform, which of course is HIPAA compliant, and we manage the case from our platform. You just have the devices in the home that you're using.
Okay. So they are using, if it's on video, they are using their computer. And do you use any particular software to provide the privacy and HIPAA
Um,
compliant
yeah,
privacy?
yes, our contracted vendor for our platform is HIPAA compliant.
Okay.
So yes, it has to be in this day and age. With all the what is that called? Somethingware. What is it? Spyware or ransomware? Ransomware. Just breaches on personal privacy. But HIPAA's been out there before all of that even came about.
Right.
Yes.
How does insurance play in to this? Are insurance companies supporting this concept?
They are. They
and
are, and they're becoming. I'm sorry to interrupt you. Go ahead.
No, go
Ask
ahead.
that question.
You're heading where I'm leading you.
Yes, insurance companies. It's a service. Actually, most of my career has been working for insurance companies, because it's these specific diagnoses that we are servicing are high dollar to the insurance companies. So our goal with the insurance companies is to lower that cost, again, improving the health literacy of their members. And just a minute ago, I said members, patients, they're different. If you're with the insurance company, it's a member. If you're with the doctor, you're a patient. So that's why I use those different terms. But yes, to answer your question, insurance companies, not all of them, but most of them, I would say the wiser ones, are now paying for remote medical monitoring.
Now I think I've forgotten my question. We're
As
both
is
curious.
CMS. CMS is the Center for Medicaid, Medicare. They do as well. It gets a little bit more complicated when you have to deal with those codes and all of that. We bill the physician or the client directly, and then it is their responsibility to determine how that service is paid for.
Okay. I know what my question was. Is you obviously have staff members, or you may not at this point, since you're new. If you do, are they cross-trained on all of these diagnoses that you're treating, or do you have specialists for each one?
These nurses have to have a minimum level of experience, work experience with these diagnoses specifically. So if you are a pediatric nurse, you wouldn't be able to perform within this company because you don't have the skill set for these diagnoses. Of course, you know something about it because you're a nurse, and we hire registered nurses to fully manage the cases. And if it's a chronic care management, catastrophic disease, then that is managed by CCMs, certified case managers.
Okay.
And we also have LCSWs, registered dietitians, as our support staff.
Wonderful. I bet the nurses love it, to be able to
They do love it.
see so many cases and the variety. What's the average amount of time that you spend with each patient? And do you
Well,
have
I'm going to say
limitations based on
that's
your
our
contract?
niche. That's our niche, because the whole goal earlier, I had said if I could take a little bit from this company, a little bit from that company, and develop my own, I would have a stellar company. What what we don't want is the patient, the member, the client to feel like another or a number or just another call. So as long as it takes with that patient, and we want to build a rapport. Yes, we can talk to you about, well, how are the kids today, or how's the dog today? I know you just took the dog to the vet. You build a relationship so that, you have a good rapport with that patient. That's very important. But we don't want to go down the rabbit hole with the vet, and the vet said this and the vet said that. Reel it back in, and let's talk about the diagnosis. We get there, but at the same time, we want to have a good relationship a personal relationship with the patient, the member.
Do you do you generally have the same nurse assigned to the same patient for that
Always.
continuity, unless there's a absence or that sort of
Always,
thing?
always, unless that nurse is on, and we have pods. So there's a registered nurse, there's an LVN as a support, and then there's a care coordinator who does the general task, the faxing, the uploading of certain documents into the file, and that care coordinator floats among all the staff. But, we have a nurse-patient ratio, and to keep it flowing well and to not overwork anyone and to be able to maintain that relationship with the patient.
Corporations, especially larger corporations, especially self-insured corporations, um, must love this. Where is it in terms of adoption? It's got to be in the early stages, but sort of give us an idea of adoption, not just for your business, but for this field in general, because telehealth is coming on faster because of COVID. Where is
Right.
this industry?
Well, telehealth is not really, we don't fall under that term telehealth. Telehealth is mainly for the doctors and them running their office practice, talking to their patients from the office. We are a supportive service that kind of falls under telehealth. And I don't know how, but I just don't operate under that word telehealth. All of this disease management in this area, like we're doing it, is pretty new. It hasn't been out there for years and years, but it's been out there for a little while. It's becoming to the forefront just because of things like COVID. COVID definitely propelled it to another level, but it was out there prior to COVID because the world is just changing and technology is coming, is such a large player in our everyday lives. And it's an opportunity for healthcare to use that technology to reach people to improve their health overall, which improves the nation's health wellness.
Wonderful. And so are you finding corporations, especially self-insured corporations, more and more interested in this service?
Slowly but surely.
Okay.
Slowly but surely. And because it's so new and because I'm new in the business, I haven't had the opportunity to present to large corporations or smaller corporations. You don't have to be a large corporation. We can take anywhere from 50 to 500 cases. Um, so you don't have to be a large, conglomerate to utilize our services. But I, the the return on investment is really what the stumbling block would be. And then you have to look at that person, that hears about this. What are you looking for? Is it monetary? Do you really want to improve your patients, your staff's, your members' health? If that is what it is, then there is your return.
And sometimes it'll maybe most of the time it'll be hard to measure. I mean, you're
It's
going to
hard to
have
measure.
data, you're going to have data, but these patterns haven't just started amongst the patients. These the bad health habits. Um, so changing them is slow, but you know, HR in general is so aware of this problem, and they're working. This dovetails with a lot of trends that were happening. And as I mentioned before the podcast, one of the things that I think we're seeing with COVID is that trends that were progressing have just skyrocketed. And it exists in so many fields: video
Hmm.
conferencing, um, the adoption of technology, all sorts of things have escalated as a part of, as a result of COVID. So I
Right.
see the timing of what you're doing is actually perfect. You mentioned about
It's the
maintaining a
perfect
relationship.
storm.
I'm sorry.
I'm sorry. It's like the perfect storm. And I if had I known about this podcast a little earlier, you did tell me it was a curveball. I would have had some data for you where I could give you figures to show how long it's been out there. And I'm just kind of flying off the cuff right now, but I could have concrete numbers and data for you had I known. But that's okay.
Well, you'll be able to send us some information and we'll put it in the show notes. And of course, we'll put how to contact you in the show notes as well. Because you're remote, can you service anybody anywhere as long as they have a phone or internet?
Absolutely. I am licensed. Now, there's something called compact states. That means certain states um, recognize nurses from other states, and you can practice in those states. If you are a compact state, you have to be housed in a compact state before you can reach out to another compact state.
Okay.
So I, in Kentucky, with Kentucky registered nurse license, am in a compact state because Kentucky is a compact state. So I can reach out to other states that are compact. But in addition to that, I have my California registered nursing license and I have Michigan nursing license. So we practice in those. Now, I would not want to have nurses in Kentucky necessarily working with patients in another compact state. I would prefer to hire within that state because they know their resources better than we do, right? So if you have a case that is a complex case, and then you need to pull in your resources for that person. Let's say they have a barrier with finances or they have a barrier with nutrition. That state, that nurse is probably going to know in that area that that person lives, know better than we are here in Kentucky. However, now there's the internet, right? You can find out anything you want. And there's certain governing agencies that manage things like that, and it's nothing but a phone call or research on that. So we could work in other states. Back to your question, yes, I'm not limited to Kentucky, but as a new business, I'm starting in Kentucky. Um, Start in your own backyard.
And what are the other states? I generally understand about compact. What other states does that enable you to work in? And you're licensed in California and Michigan. What other states can you automatically work in? Maybe some of the more populous states that are compact states.
Mm, Indiana. I have to look at a map. I
Okay.
don't think Ohio is a compact state. I really have to look at a map because my focus right now is just to grow my business within Kentucky.
You're a font of information. You've got so much information within you about this service and beneath that. Um, there are probably some things that you haven't shared at this point. What types of information would you share about the concept, about how it's going so far? Um, and I will pick up on something. Libby,
Mhm.
uh, cut that musing out if you would, um, and beyond. Um, so we'll start here. Start back here. So you mentioned that corporations are slow to adopt. So talk about some of the objections that you hear. What do you think the resistance is about? On the surface of it, um, it's a no-brainer, especially for things like diabetes and hypertension. Businesses are focusing more and more on wellness, especially the larger companies have wellness resources and programs and gyms and all that sort of
hmm
thing.
hmm
So, what are you hearing are the uh, areas of resistance? Is it just about money?
I would have to say no. I have to say knowledge deficit. They just don't. They're unaware of the program. Um, and you brought up a good point about gyms. You know, they send their employees or pay for employees gym memberships. So this comes right in line with that. Of course, you don't want everyone in this program. Everyone doesn't meet the criteria for the program, which would be to have one of these diagnoses and to be um, um, challenged with it, you know, the health literacy with it. And by the way, health literacy is not offensive. You know, you can have your PhD and still have low health literacy. You're an expert in what you do, but when it comes to your health and, you know, why you're taking certain pills or the physiology behind a certain organ, you know, you may not be aware of. So that's just low health literacy. I don't want to offend anyone by using that term, but I think the barrier would just be simply knowledge deficit. They don't know this is a service out there. Everyone knows the gym's out there, but that's it. That would be it. They would see a return on investment. And for large corporations, I don't believe that it would be money because it's not that overly expensive service.
Hmm. Um, that brings up another point. Within the individuals, it's also not just a knowledge deficit. It's about habits. It's about self-discipline. And I hope not to offend, but when I see nurses outside of the hospital or the doctor's office smoking,
Oh
and
yeah,
they're in a ring of smoke, and I I hesitate, but let me
I
just go
know.
ahead and say it. The obesity rate of
Yeah,
nurses, um, just that I see, just anecdotally, but I bet you statistically, it's at least as high as the general population and maybe higher,
and
probably
maybe
because of
more.
stress. Um, so it's not just about knowledge. They know what's healthy and not
Mhm.
healthy. It's about
Mhm.
being able to be disciplined, um,
Mhm.
and to have good habits to be able to incorporate those.
Right. And there's other things that play into that. You know, that's where let's just say that we have that's a good example, a nurse who's out smoking. You know, what is the cause? What is the root cause of that other than habitual, other than it being a habit? So, you know, maybe we would pull in an LCSW, of course, not for the nurse. We're talking about a regular patient. The nurse has the resources and knows what to do more than likely, but maybe not. I don't know. So let's just pull in an LCSW to help address the root cause of that and to deal with the barrier that is prohibiting that person to reach optimal health because you're not going to reach it smoking that cigarette. And there's some people who just simply do not want to make a change. And we accept that because your life is your own. So we're not walking around with hammers and um, medical books banging anyone on the head. You know, you make a decision. Our goal is to have you to make an informed decision
Hmm.
so that you understand why you're doing what you're doing.
Couldn't hospitals be interested? Shouldn't hospitals be interested in promoting good health amongst their employees and provide this service for their employees?
For their employees, they do have programs, health programs within hospitals
No, I
sometimes.
mean your
I've worked.
program.
Oh, well, my program would be more beneficial for their patients because they have their within the hospitals, within that the insurance company that the nurse is working under, they will have access to health resources and behavioral health resources as well.
Okay. Yeah, most will have an EAP, maybe smoking cessation programs and that sort of thing.
hmm All of
But
that kind of stuff for their employees, yes. But for us, you know, coming out, For hospitals especially, we help decrease their readmission rates because they are being fined by the government if they have a certain score, to show that someone has had a return with the same diagnosis. There's a reason for that. Some people it's just physiological, they're having declining health. It's not going to get any better. But we can help with the amount of utilization that's coming through. And we can help lower some of those down to, nothing. They're not coming back utilizing the emergency room every time they have a high glucose reading or something like that because they now understand how to manage that at home.
So you're teaching them to use the monitor, whatever the situation is. If they think they're having an incident or something, they
Yep.
can plug themselves in and check it out.
Right. The monitor is an educational tool and a monitoring tool. It's an educational tool for the patient or the member. It's helping them see what should my numbers be. Okay, I did this today. Look at my numbers. Something's wrong. I've gained 2 pounds. Did I eat salt yesterday more than I'm allowed to have? Did I have too much fluids? Whatever the case is. Did I take my diuretic? Did I take my medications? There's more than I can even explain in our sitting today.
Mhm. We talked earlier about Thrive and our main mission being to reduce the impact of this epidemic of loneliness that we're feeling. I,
Hmm.
um, and you've talked about developing relationships, personal relationships with your
Hmm.
patients
Hmm.
through this. Um, I can see how just that emotional connection that they're making, especially if they're homebound or limited, older and limited in their interactions with people, I can see how the combination of developing a personal relationship with someone who is committed to helping them improve
Absolutely.
their health, and also we know that accountability is part of that.
Hmm.
So not only
Absolutely.
being accountable to themselves, but being accountable to you. Weight
Hmm.
Watchers is built on
Hmm.
that
Concept.
accountability to others. So talk a little bit about that.
Well, we look at people, it's like a biopsychosocial. We're not just looking at the diagnosis or the disease. I like to say diagnosis. We don't want to own it. Well, you have to own it. That's a whole nother conversation. But we look at the individual as a whole. That's why you want to build a good relationship and a rapport to someone because that helps the person feel connected. It helps the person with self worth and self value. It helps them with that loneliness. You have someone who really cares to talk to. That's why I said, how is your dog today that I knew was sick and you took him to the vet? That's important because that's looking at the whole person. We're not going to spend an hour talking about that, of course, but I want them to know that we care because we do care. And in the hiring process, that's something that we're looking at. There's a lot of nurses out there, like you said, that smoke cigarettes, but there's a lot of nurses out there who are not passionate about the craft. Few, I like to think, but you have to have a genuine love for what you're doing so that that comes through. You have to be able to hear a smile through the phone that you don't have a video with. All of that is important. You have to address all of it. And so we are a passionate group that works with Health Maintenance Advantage, and we look at people on a biopsychosocial perspective.
How important do you think video is to your concept? I know that when I'm meeting with people, when I'm meeting with clients in my day job as a marketer, um, normally I would pre-COVID I would have an initial phone call with people. But for example, I noticed that I mentioned an idea and a price for a particular solution to a client, and I saw just through their facial expression, whoa,
Mhm.
that is not the way to go. I'm not going to do that. Um, how important do you think video is, um, and what percentage of your cases would you say do involve video, either on the phone or on their computer?
I'm going to say 80%. There's some who just prefer not to be, shown, and that's absolutely fine. Um, it's the next best thing to in person. I mean, how much
Mhm.
closer can we get than the video? The conversation over the phone is great, but it's nicer to be able to see that person that you're talking to. We say that in just regular business day to day, right? You talk to so many people over the phone. The nurses are virtual, although we have the capability to, when we have our meetings and when you come in the morning, you can video and say hi to each other. It's like working in an office. Um, but it's very important to have the video concept. And then let's just say I have someone that says their ankles are just more swollen and painful. I can call that doctor and video him in and let him see that patient to get the visual on that
And you can
if
also see
necessary.
if you're,
If necessary.
yeah, you can also see if your diabetes patients have a cupcake in their
Yeah,
hand.
absolutely. Yeah, we can do that too.
Put that down.
They learn the
Um,
game quickly though, and have their area cleaned up before the call.
um, I see this as not the very beginning, but a next step in the adoption and incorporation of technology into healthcare. And I think we're just beginning. It doesn't take too much imagination to think of some sort of monitor, and they're already talking about it and testing these, a monitor of several functions embedded like the birth control rods that
Mhm.
are implanted under someone's skin.
Mhm.
Um, and that way they you'd be able to check 24/7 and have an alarm go off if their heart rate
It's coming
starts
to
to
that.
jump.
It's
So,
coming to that. That's probably the only thing that the Jetsons left out. Do you remember the Jetsons?
oh yeah,
Did you ever see that? Isn't it
oh
amazing
yeah.
how it's caught up to today's world? And all we're waiting for now are cars that can fly over another one instead of passing it, right? Um, yeah, so it could come to that. I think one of the coolest medical devices out there is the one, and we do not have this, the one where you put two fingers on the pad and it will run your EKG. That is amazing.
And what they two fingers and then what?
Two fingers on the pad, and then you have your electrocardiogram that's sent to your doctor.
Hmm.
That is a
Well,
very cool, like I said in the beginning of our conversation, technology, it's healthcare is in the perfect storm to take advantage of all the technological advances out there to reach the goal to improve everyone's health. And I hope one of my goals is to reach the underserved, disenfranchised. I want to help there too. I won't
hmm
say mainly I want to help everyone, but I really hope to be of benefit for those who would need the service the most.
well, and I think because it drives costs down, that that it will push health maintenance down the economic status ladder so that more people will be able to get it. Now, it probably will be that the wealthy have their private uh, concierge medicine doctors. It probably is already this way, and the lower income people will only be able to have a consultation over video. Um,
Well, I hope.
but still,
I hope to be able, if once I grow enough, I hope to be able to do some pro bono work. I mean, it's not, our lives is not all about my life. Let me speak for myself. Is of course I want to make money and sustain the business, but I also want to honor my calling and to help others. And I believe in being the founder of Health Maintenance Advantage. That is one of my goals. So if it becomes large enough where I can support some free service, I have arrived if when I'm able to do that. And speaking of free services, we have webinars. that, and we're trying to promote those quarterly. My stumbling block with that is finding physicians or practitioners that will pro bono speak, be a presenter at little to no cost, so that we can keep these going on our quarterly with our quarterly goal. So we did one on diabetes. You do not have to be a participant in the program to join that. If you're listening to this podcast, you have diabetes, visit the website and see when the next webinar for that is. And all you do is register. There's room if there's a seat available in the virtual room, then you're more than welcome to join. We usually have a dietitian. Speaking of just diabetes, we have the dietitian, we have an endocrinologist, or a diabetic educator, and we give freebies, free books, gifts at the end. So it's going to be, the gift is related to the diagnosis. Last year we gave a cookbook for diabetes on nutrition.
Well, and maybe you can get doctors' offices, hospitals to sponsor it and get some promotional value out of it. And then
I'm glad you said that. You said that, because I'm a registered nurse, not a marketing person. To be able to have the capability or the insight or the knowledge, the literacy to go in to address this with, how do you even ask for a sponsor other than to just walk in and ask? That's something that I need to work on, is how to approach that. Yes, it would be wonderful if they would sponsor. I just don't know how to ask them.
Yep. Well, maybe there's some marketing resources out there that could help you with that.
Maybe. I heard you say you were a marketing prior, so let's talk.
Oh yeah. So let's. I feel like we're starting to wind up here, but I want to talk about just a little bit, because I think the intersection of technology and healthcare has one major downside, potential downside, and I think it will be a downside, and that's privacy. Because as we get more and more intrusive with this implant in the arm, I know that you're covered with the video somewhat. For example, I have no doubt that if my insurance company doesn't have the data from my Apple Watch, that they will at some point. So it'll be a matter of being classified, because that data is out there, that will be classified by our health risk, and insurance companies will know what our conditions are, what our vitals are, and even though they won't publicly admit that they are ranking us by our risk and billing us by our risk, they'll do it and we won't know it. So I don't know. What are your thoughts about that? And from our cybersecurity podcast that we've done, we know there's no such thing as security. There's no such thing as privacy. We're giving it up by carrying our phone around. So, and what are your thoughts about that?
Well, I can only speak to the business, because from where you're coming, your aspect with it is just larger than large and very true. I mean, security in general is an issue. I can only speak from our business standpoint to say that everything that we do is HIPAA compliant. Yes, there is a problem with ransomware and all of that kind of stuff, but there's also now new firewalls, so to speak, and things like that to protect us. So, we do have HIPAA compliant protocols, privacy training, all kinds of stuff like that.
So essentially you're doing what you can do from your business perspective. Okay.
Right.
Okay.
Yes.
Um,
And I just
so
wanted to say one thing about, going back before I forget, because I will forget, but we were talking about return on investment. The savings come from the decreased complications and, um, stopping the productivity losses for those corporations. It's a balance between quality and quantity. What am I trying to say here? The balance of quality as it is in life and the cost is of the return on investment. Did that make
got it.
sense?
Yep,
Did I articulate that?
you did.
Okay.
So I have never had a less subtle reminder of time, and we did not talk about our time constraints. So let's wrap up, but give us your website, your contact information. How can we press you to provide services in another state? How do people contact you?
Our website address is www.healthmaintenanceadvantage.com. Our office number is 502-488-8715. Both of those are on the website. The contact email is contact@healthmaintenanceadvantage.com. You can either send an email directly or go onto the website and hit contact us and fill out the form there, and we will get back in touch with you.
And can they sign up? Where can they sign up wow? Can they sign up for the webinars on your website?
Absolutely. Yes.
Okay.
And there's information, and actually there's a video because we're a member of the American Heart and American Diabetes Association participants, and we try to gear our classes based around their initiatives, what they're having. The last one was No Diabetes by Heart. There's a video on there from the American Heart Association. Just go to the website, look at video, and click on it, and it's now talking about blood pressure because that's our next class. That's our next webinar. Hopefully, so if anyone is out there that is qualified to be a presenter, such as a cardiologist, a primary care physician, a nurse practitioner, please do give us a call, and we would love to have you as a presenter for one of these webinars to reach our common goal, which is to reach the community to improve health.
Do you need nurses?
Yes, nurses specializing in cardiovascular. Sure, we can talk about it. I prefer to have, I'm the nurse and I do the presentations as well. But if we have someone who specializes on a higher level, absolutely. I am willing to have any speakers on there. Yes, we need nurses, not any speakers, doctors, nurse practitioners.
Great. Will you do the dance again as we check out? Thanks again to Sherri Williams for joining us today to talk more about her work with Health Maintenance Advantage. To hear more stories from professionals like Sherri, don't forget to tune in to our next podcast. You can also learn more about OutMarket.Pro by emailing mark@outmarket.pro or calling 502-333-4718. You can also check in with our website at OutMarket.Pro. Be sure to subscribe, like the episode if you did, and click the notifications. All right, thanks, and we'll see you next time.